Hi and welcome to today's webinar by CM Medical. I'm your host, James Moore, and I'm a talent solution specialist who serves the digital health market, but that's not why we're talking today. This webinar is all about how digital health is tackling the mental health crisis. And to discuss this subject, I'm delighted to be joined by a panel of leaders in the space. But before getting introduced to them, I just want to remind everyone there will be a live Q&A that's going on throughout, and we will get the chance to answer these questions at the end. So please submit and we'll answer as many of them possible. But I suppose to get started, let's meet the panel. I suppose starting with Monique, would you like to introduce yourself and tell us a bit about your company?
Sure, James. Thank you. And good afternoon, everyone. Monique Fayad, I'm the CEO of Trellus Health. Trellus is a resilience-driven connected health solution for chronic conditions, starting with inflammatory bowel diseases. So those are the diseases of Crohn's disease and ulcerative colitis. We are a spin out from the Mount Sinai health system where our two co-founders were utilizing this methodology that we have licensed from Mount Sinai. And we've actually digitized it and built a proprietary platform to scale it to provide the same level of mind-body care that they were delivering at the Mount Sinai IBD Center to all potential IBD patients. So it's exciting to be able to bring this approach to the masses, and hopefully we'll be seeing the same incredible outcomes that they were able to realize at the Mount Sinai IBD Center.
Perfect. Thanks, Monique. And to move on to Jennifer from COA, would you like to introduce yourself?
Hi, thanks, James, and thanks to CM Medical for inviting me to participate today. Thanks to everyone who joined, and of course to my esteemed panelists, Monique and Mike, always a pleasure. My name is Jennifer Gendron, and I am the Chief Commercial Officer here at COA Health. We are in pursuit of mental health for all, and we're doing that via bringing digital mental health solutions that are evidence-based across the continuum of care to employers and health plans. And I think as we go on today, I'll talk more about kind of what that looks like and what makes COA special in that regard. A little bit about me. I have an interesting journey to getting here, and that I started my career as a licensed mental health professional myself. For about 12 to 15 years, I did all sorts of therapy, from individual, group. I worked in the prison system and hospitals. I did many years in emergency mental health. And all of that really taught me that, nobody's exempt from hard things or difficult times, that it's, not if, but when, and certainly that we all have mental health and it happens on a continuum. So I'll be happy to talk more about how that brought me to COA today. For the last 12 years, I've pivoted over to the business side and been in digital health leadership roles at mission-driven companies. So coming to COA feels like home for me, bringing together those two past experiences.
Perfect. Great. Look forward to hearing more on that. And finally, Mike, how are things going?
Going well. Thank you, James. And morning, afternoon to everyone. So my name is Mike Rolla. I am a Chief Revenue Officer here at UpHealth. And I joined UpHealth by way of Teladoc Livongo. And before that, almost 17 years with Becton Dickinson in the health system space. At UpHealth, we really have three primary areas of focus: integrated care, virtual care infrastructure, and services. And with regards to behavioral health or mental health, and the digital health overlay here, we have substance abuse, we have population health management, and we have traditional telepsych and telehealth, all of which touch the delivery of care on the behavioral health side. So happy to be here, happy to join this great panel.
Perfect. Thanks, Mike. And I suppose the first topic of conversation I want to do, which is kind of the whole webinar focus, is to discuss exactly how digital health is tackling the mental health crisis and why there's such a need for that. I mean, with how things have progressed over the last few years, 1 in 5 US adults live with a mental health illness, how bad things have got, and how digital health can tackle that. I mean, I suppose starting with Monique, all you guys obviously have a passion and need for the care of slightly different, areas, but would be good to get your thoughts on exactly how digital health is helping this, crisis in the US and all over the world.
Sure. Well, I think digital health is definitely helping. The key problem is access. There's not enough, live healthcare, mental health providers to provide the level of care, and especially during the pandemic. So there's an intense need and intense appreciation for the need for mental health support and services over the last couple of years. That, in a way, maybe it was a good thing that it brought, a strong appreciation to the need for mental health support services. And clearly the market recognized the need by pouring a lot of funding into, digital health, mental health startups over the last 2 years. Last year it was up, over 75%, or actually digital mental health app funding was over 130%. So the market's recognizing the need. There's a lot of solutions out there to help with the access issue. But I think it's interesting to see all the different approaches of how different companies are approaching it. At Trellus, we actually approach it from the perspective that you still need a human person involved. So we're not a purely digital app. We believe you still need that, apps can't necessarily move the behavioral change significantly enough, especially when you're dealing with a complex chronic condition that's associated with mental health, such as inflammatory bowel diseases or other major complex chronic conditions. So we like to look at mental health and physical health together. So we look at the whole person, not just their mental perspective or their clinical perspective. We look at them holistically, and we have a proprietary approach to actually assess resilience and measure resilience and quantify it. So, and then we work with our patients over a period of 6 to 8 months to move them to a point of resilience, after which time we reassess them. And if they've attained resilience, that means that they'll have a much lower likelihood of any unplanned care events, and they'll also have significant positive health outcomes in terms of quality of life and reductions in opioids and steroid use. So again, we have a platform to enable our care plan and our assessment, but we still believe that you need licensed healthcare professionals to help patients to kind of cope and adjust their behaviors to have meaningful change.
Yeah, no, that's really interesting. I think it'll be evident through talking, and Trellus Health as well, working with you guys and knowing the platform. It's evidently not just a one-stop quick fix kind of thing, which is something we'll go on to, and the holistic approach of how digital health is working and why that's obviously a benefit, but also challenges in the market as well. So thanks for that. And then I suppose, Jen, working with Co-op on overall, your view on the crisis that is mental health at the moment, the difficulty, the crazy numbers that we're seeing, and how you think digital health is tackling the crisis.
Yeah, I would definitely agree with Monique, this idea of access and convenience. For me, when you think about digital mental health, it's always there. You certainly don't need to wait. And that's really how mental health symptoms work, right? You can experience them at different times without much warning. And that's why for us at COA, and for me personally, really, I believe in digital health solutions being available kind of 24/7 in your pocket that can help you kind of wherever you are, whenever it is. I know, most of the organizations and people that we're working with at COA, they are working different shifts, right? They're, of course, dispersed across the country or globally. Some are remote, some are in person. So it's a very certainly convenient way for them to access support. It's also a discreet way for them to access support, I would say. Unfortunately, we're still combating stigma as it relates to mental health. But not only that, what we're hearing from many people is they just have a preference when it comes to mental health for self-help. So it really allows you to access that help discreetly and conveniently. And I have a few more thoughts on this before I pass the baton, unless you want to wave me off, James. The other one is I feel like digital mental health allows you to really build mental health skills kind of every single day, right? Which seems more scalable and more effective than only learning those skills when you are in the office with a clinician. And along those lines is the quality or the kind of standardization of quality in digital mental health. Being a clinician myself, I know that I definitely had off days in the office, and you can really, count on consistent quality when it comes to digital mental health. And then I would say, last but not least, is the idea of personalization. When you think about digital mental health, right? We've got so much data that's coming in, and it really allows us to tailor to the individual, and that really leads to better and kind of more equitable outcomes overall. As I mentioned earlier, we know, mental health happens on this continuum, and digital health really has the ability to support people kind of wherever they fall on that continuum.
No, perfect. That's great. And I think it's really interesting to hear, obviously, from someone who's been on the clinician side as well. I'm sure that brings so much value to COA, in particular, understanding both sides on the business area as well. So thank you for that. And then Mike, would be good to get to know, obviously, in depth background, like you said, with Livongo, and now a slightly different mission with UpHealth as well. Your thoughts on what you've seen over the years and the struggle that mental health is having in the US at the moment and everywhere, I suppose, and how digital health can combat this?
Yeah, it's a great beginning question. I think, you always want to answer the question with a little bit of a question and say, what part of the mental health crisis is being tackled? And what I mean by that is you have the wellness space, right, where the apps and platforms we've seen expand rapidly, more new names and companies than I can keep track of. On the population health side, some of the points that already came up, I think, are critical, right? Access to care transitions, as well as just looking at the overall predictive risk modeling of who is at risk, why, what are the factors and things like that. But ultimately, I think the crisis boils down to something that really precedes digital health as we know it, which is, I think this is like an AHRQ data point, but more than 50% of individuals with mental health needs don't have a relationship with a PCP. So how are you addressing that in going forward, right? Are you going to go via the plan, via the provider, via a direct-to-consumer solution? Because even those that do have a relationship, more often than not, don't receive the right diagnosis and support. And when they do, the out-of-pocket expenses are still higher than for virtually any other intervention. So some of the problems actually precede digital health as we know it today. So tackling that is, I think, probably the most unique thing, because you have to kind of pick which area you want to, attack first.
Yeah, definitely. I mean, obviously the problem being huge, it's difficult to answer on one question, but the insight of the different areas which we can go into. And I suppose the next topic I wanted to discuss was something I know, we're all singing off the same hymn sheet on, is the fact of the area around saturation maybe, and funding in the market as well. I think, in the space in 2021, it reached nearly 5.1 billion in startups alone. And how, where there's so many companies in the space and startups and solutions, how, they're differing from your guys' platforms, especially, I suppose, relevant on the Trellus and COA side of the scientific based, the evidence based, and the actual full point of care, and how, the market needs to be careful of the quality of care, which is actually given on both the consumer market on that side. So I suppose, Monique, to start off again, your thoughts on that and ideas around that.
Yeah, I mean, it's pretty staggering when you consider there's about 200 mental health apps out there. There was a recent article in Journal of Medical Internet Research. There are about 200 digital mental health apps. 97% of them have no scientific backing or validation. So there's a lot out there. Clearly, again, the market has funded that, and people were able to, the barriers to entry were low, and people were able to develop apps. I think what's really going to differentiate and help the market are those that do have science behind them, that do have expertise and validity, and and can prove themselves. That's what's going to really, those are going to be the winners over the next couple of years. It's going to take a year or so for, or at least probably for a shakeout, but being able to prove benefits and positive outcomes and have science behind what you're doing is really going to be the key differentiator with all of these different apps.
Yeah, definitely. I think from what you said in even the intro, the way, what companies like Trellus are doing on the holistic approach side, it's not just, like I said, a one-stop approach. So I think, as you say, in the next couple of years, hopefully it shakes it down a bit more, and we're left with just the main positive ones. And I suppose, Jen, on that, I know COA have a heavy scientific based approach to doing things as well, on that, and your thoughts on the funding and, saturation that we're now seeing in the market.
Yeah, I mean, I like to challenge this assumption of oversaturated market or saturated market, right? I mean, I would say that digital health is really still a very nascent industry, and therefore there's lots of new approaches, and that's really a good thing, right? Because we're still learning, and we know the CDC and others are reporting these historic levels of needs, certainly compounded by the pandemic. And so I don't see the market as being anywhere near saturated. However, I certainly understand that it can be really confusing for buyers, right? There's so many digital health solutions. I would say there's even globally hundreds of thousands of apps. I would agree that there's 2 to 3% of those that have true evidence. And so for me, when I'm thinking about folks who are kind of vetting digital health or mental health apps, I definitely would encourage them to kind of challenge the claims of being evidence-based, right? Do they have RCTs? Is the evidence their own? Do they have clinicians that are building and really driving their solutions, right? And for mental health apps, there's also other kind of independent expert reviewers like CyberGuide or Orca that can help folks assess quality as well.
No, perfect. That's good to know. And I think, on that, Mike, what are your thoughts? I know we had a discussion on that, as we all did. I think the words you did maybe on the slightly called them the fuzzier app side. What are your thoughts on this?
Yeah, I think there's a couple of great points that preceded me, so I'll try and keep this semi-short and sweet here. But yeah, there's an oversaturation right now of content and decisions to be made, and a great many of the apps provide a supportive role of late, right? Especially in the wellness space. So it's really easy to say yes when you just look at the size and the funding and the names that have popped into the space. But ultimately, like kind of dovetailing on where Jennifer just finished, I think until we see really compelling data that the access to care has been greatly improved, and or the right outcomes, this is just further validating the need. So oversaturation, I think there's a far more sophisticated decision that now has to be made, but I wouldn't call it oversaturated at this point, just because the need is so big.
Perfect. No, that's really interesting. Obviously, the competitive market is one. I, at this point, want to just remind the audience there is a Q&A running, so please put the questions in, and we'll be able to ask them to the panel at the end. But I suppose the next point we spoke about is getting the digital mental health solutions like you guys work with to as many people as possible, and where in the market I suppose this is most useful. I think 1 in 6.8 people experience mental health problems in the workplace. Now I know the employer space is somewhere where you guys have all worked in and sold in your respective companies. I suppose starting with Monique, you're inside of the employer well-being and how big that is for digital mental health, but also getting the care to many people through that, and companies buying in for that as a benefit for their employees as well.
Yeah, I mean, employers, again, are kind of inundated with a lot of different offerings right now for digital mental health. So again, having evidence and having science and actual clinicians involved in the development of your solutions, I think is really important to differentiate. With our solution right now, we're targeting IBD, which is about a 1% prevalence. So it's a lower prevalence. It's not quite as big on the radar of employers as some of the larger and more prevalent conditions such as diabetes and heart disease and kidney disease, et cetera. But we are working to extend our approach into those other diseases. Our license from Mount Sinai does apply to 7 broad disease categories beyond IBD. So we're having the discussions now with employers about educating them. IBD is an incredibly expensive, from an employee and an insurer perspective, an incredibly expensive disease because it's diagnosed early in life and it's a lifelong incurable disease and has a very high degree of mental health burden. So typically anywhere between 30 to 50% mental health burden, and during a flare or around a surgery, it's even higher, and especially upon diagnosis at an early age. So there is still some education going on with employers about the crisis with mental health with IBD. We're looking at expanding into IBS, which has about a 10% prevalence, which has a bigger impact on employee productivity and absenteeism and presenteeism. So that's a logical extension from what we're doing in IBD, because IBS is identical to IBD, except there's no underlying autoimmune disease, but a lot of the depression and the anxiety and the symptoms are there and need to be addressed, and can be addressed through our holistic approach. So again, we're musculoskeletal, and diabetes seem to always get the big focus from employers from a cost perspective, and we're trying to do more on the side of educating them around GI diseases and how the intersection of mental and chronic disease need to be addressed.
Perfect. No, that's interesting. I suppose while we're on that, I wanted to give you opportunity to speak on as well what I think is a really exciting, positive move of developing on the direct to consumer, getting people, across your area using Trellus's holistic approach, and how, looking forward to getting the data from that and how you see things moving from there.
Yeah, it's really exciting. While we're working, our primary revenue streams are going to selling into insurance insurance plans and employers. As we all know, those deals take time to happen, and the contracting takes a while. So our goal, again, was always about providing access to this gold standard of integrated mind and body care. And so we have a dedicated care team. They're licensed in the New York tri-state area to deliver care to people, with IBD. And, we're basically, opening the doors to anyone to come in, for GI providers to refer patients in, and for patients to come to us directly, so that we can, provide these solutions to them while, we have significant capacity to do that. So it's early days. We just announced our direct to consumer, last, a few weeks ago. And we're starting to work with some of the major practices in New York City to start referring patients into us, and all the large academic medical centers that don't necessarily have mental health support or nutrition support resources available to their patients. So it's just, again, providing that access to care and it's all remote. So these patients who do typically have significant challenges traveling because of their symptom burden and their issues with their disease, it's very easy to access our healthcare providers and our platform. It's all digital. So it really just, it's all about improving the access. So we're just getting started now, and it's exciting. Our goal is to, again, just get as many patients under management, get as much data as we can, and start publishing that we are, replicating those same tremendous outcomes that they were able to realize at the Mount Sinai IBD Center, which is the birthplace of Crohn's, and our two co-founders came from there. So we're excited just to put it, get it in use and get our own data.
Yeah, no, definitely. I think looking on from the work your two co-founders, as well as you as well, of course, have done, but the research they've got and the data is obviously proving itself. So exciting to get that data through. And I suppose to move on to Jen as well, I know a lot of the work that obviously COA do is on the employer side, as well as recently employing some great health plan focused salespeople as well. But what are your thoughts on, how important the employer gate being into the digital mental health well-being and the work COA do in that?
Yeah, this is a really interesting one for me, and I will definitely follow Monique and Trellus and see how they do going B2C. But one of the reasons that I truly joined COA was because we were built for B2B. So our app was truly built B2B. And I think there's a couple of things about that, right? One is when you think about how much time people spend at work, they spend it something like I meant to look it up before this, but I think it's like 1/3 of their life at work, right? They're there all the time, a captive audience. And it's a great opportunity to really provide them with the tools they need for their kind of whole health, their holistic health. And we are seeing a gap right now in the research that says, employers are spending large budgets on average. I think it's like $6 million. 92% of employers added behavioral health programs last year, but we see high percentages, 80% and upwards of employees that are saying that actually work is negatively impacting their mental health. So we see this gap that COA is really trying to bridge. And I think, mental health and burnout, you need to take both a top down and a bottom up approach. And, employees need solutions and support to help them feel better. However, if they're within an organization in which there's not a culture of mental health, where employees feel like they can access these tools and talk about their mental health, then you're going to have a disconnect and won't have the success. So COA is really doing both, offering solutions for the employees, but also partnering with organizations to give them solutions and training to really create this full culture of mental health, this culture where it's really okay for people not to be okay. And particularly when you think about burnout, right? This is a really kind of hot topic. We hear about this all the time, unfortunately, but this is really an organizational phenomenon, right? And so it's really important, again, that the focus isn't just on giving a solution to the employee and really helping to move the needle with the organization as well. And the other thing, when I think about employers offering these solutions, James, is that it really adds another level of protection to the employees, meaning, as we mentioned, there's lots of apps out there, and they know when they're accessing these supports through their employer that they've been vetted for things like quality, data security, right? So it offers that level of protection for employees where they might not know where to start about kind of which solution to choose. And like I mentioned, people do ask me all the time, are you guys going to go B2C? But I would say, something else to think about, again, about doing both, or is it possible to do both? And again, I'm following lots of folks that are, is that B2C companies end up spending quite a bit of marketing budget, right? Because there's kind of a high churn in B2C product use. And that may make it difficult to kind of cut through the noise on the quality of the product. So these companies certainly have the brand recognition, but do they also have the expertise to partner with employers? And that's really what we've been focused on here at COA. To your point, James, bringing in folks that have all worked in the B2B employer market. Really important to us to offer the most comprehensive program we can to employers and health plans.
Perfect. No, that's really interesting. Give the insight on COA's plans as well. So thank you for that. And then, Mike, I know you've got experience kind of across the board on this sense, not just within employers, but in the health plans and insurance as well. How important do you think this avenue is, in general, for the digital mental health selection to keep growing, and how it can offer care to as many individuals across the US as possible?
Yeah, I mean, obviously critical. And I think, the best use of my time here in following these two would be, to say, what's the decision, even from a go-to-market standpoint, that needs to be evaluated, right, on the delivery of overall care, right? So yes, if you're a self-insured employer, you need to have provisions for a mental health solution. Is it part of the primary care offering? What's the out-of-pocket impact that's going to, be real world for your employees? What are the outcome measures you want to see from it? And then if you actually look at the go-to-market model, so sharing a little bit from my Livongo day, we had, roughly 70% on the self-insured employers were contracted via a third party to implement a chronic care solution, right? So taking that into consideration when you're looking at behavioral health, the question becomes, are you working with a benefit consultant? Are you working with a health plan ASO? Are you working with a broker? Are you going to, aggregate it into a virtual care front door that brings together multiple solutions? So the question becomes, as a self-insured employer, after all that, how do you want to contract? How do you want to measure it? And how are you delivering that care? Those are some of the most critical decisions to think about as you approach the market. On the health plan side, obviously there's certification of providers. That's critical. And I would say connecting care or care transitions, however you want to, qualify that would be next. And then, for us here at UpHealth, we really focus primarily on how do we expand data insights, from what's captured within the population health world. We are not, currently in the self-insured employer space now, and nor are we D2C. So I think, both individuals on the call are probably better qualified to speak to that at present than me.
No, perfect. Thanks for the insight. Sorry, did you have something to say on that, Jen?
Yeah, can I add something? Sorry.
Yeah.
I know I'm going out of turn. I think the other thing I think about with employers, right, is that I've seen this shift over the last 10 years with well-being and also mental health, that there was, this laser focus on ROI. How many dollars am I spending for every dollar I'm spending on the program? And although, of course, that's still important and we do still see a focus on ROI, I've seen this shift to these more VOI or value on investment metrics, where people care about mental health programs for recruiting and retaining talent, for productivity, for presenteeism. I've seen a few job posts recently where people actually put as one of their benefits in the job posts, a mental health app or mental health support. So it's been interesting to see the needle move. That I certainly think employers, of course, they care about the bottom line, but they're also doing this because they really care about their people.
No, perfect. Thank you. That's an interesting insight. And I suppose the other thing I wanted to speak about, which myself and Monique have spoken about before, and we'll be interested to get other people's views, but the idea of a preventative approach against actually something being reactionary. I know that's part of what everyone does, but I suppose first of all on that, Monique, the idea that mental health is such an issue, but if we could try and get maybe one step ahead of the curve and put things in place and apps and healthcare, systems to obviously prevent the problems that are coming through, and fits Trellus's niche quite well, I think.
Yeah, it's really interesting because in the way that we look at mental health, and specifically things like depression and anxiety, is that if our patients become clinically depressed or anxious, we've actually kind of failed them, because we actually want to assess them early on. And as part of our resilience assessment, we try to avoid that, those conditions, basically accelerating. We want to prevent it. So we look at earlier interventions, looking at things like disease acceptance and optimism and self-regulation and social support, all of these things that go into building a person's resilience and mental strength so that they can avoid becoming, depressed or anxious in a certain way. Clearly, certain depression and anxiety is based on, is clinical and maybe based on chemical factors, but we try to, again, work with the patient to kind of preempt that, happening. And if we do see that it does become a significant problem, we would direct them to a higher level of care than we can provide. We're not there to do the medical, the severe clinical depression and anxiety interventions. We're there to help the patients build the skills they need to mentally and socially and behaviorally cope with managing life with a chronic disease that has a high mental health burden. So we're really about prevention and building skills, like life-changing skills that people can use to cope, coping mechanisms, and so that they can live. And everyone is built with resilience. Everyone is born with it. But as we face challenges in life, certain people are able to bounce back easier, and we all kind of saw that with the pandemic, right? I mean, even people who didn't have a chronic illness were challenged emotionally, and with depression, anxiety, and our ability to bounce back from that and really leverage skills like optimism and social support and sleep and exercise and all of those behaviors that you have to do to keep yourself strong and mentally and physically resilient. And that's what really we're about at Trellus, is teaching our patients how to do that, the importance of those, assessing it and working with them where they might have areas that they need to work on.
Perfect. Thank you. I suppose leading on from that question, Jen, I suppose you spoke about going into the employers, which was really interesting, and not just providing their solution for obviously people who are suffering from mental health already in these employers and companies, but what they can do more to help prevent it as well, and giving them the coaching on that. I suppose the preventative side against reactionary, COAs, and your thoughts on that and how this can help in digital mental health.
Yeah, sure. I mean, as a clinician myself, I've seen firsthand that not addressing kind of early symptoms can certainly lead to people feeling much worse and deteriorating. There's also a study that I've been referencing, or a paper recently, and they asked 45,000 people who had mental health symptoms kind of how they would address them. And depending on how you grouped it, half or more than half actually said that they would never speak to a person. So we do have this really large group that might have preclinical symptoms or are looking more for those pieces of prevention, to your point, James. So I think it's really important. And I would say at COA, we put a huge focus on prevention, right? We are building what we like to call the foundation of mental health, which is also the name of our preclinical app, Foundations. And that really supports things like well-being, stress and burnout. It builds resilience. It helps with sleep. And we do that by providing really actionable, bite-sized chunks that are of activities that are based in multiple therapy modalities and kind of meet people where they're at. We've really invested a lot here at COA at that preclinical preventative stage of that continuum. So I think it's really important. And I would say just overall, our aims to get people back to kind of full mental well-being without the need for in-person treatment, although we also have solutions where we are looking to kind of fast track high quality digital first care as well.
Perfect. No, thank you for that. And I suppose, Mike, on the point of the preventative versus working so much in digital health, how you see things advancing more in that area and the work that can be done with digital solutions.
Yeah. So, my viewpoint on this, I don't think it's particularly unique, but I think I focus on one area where I see either the most opportunity or, where I see the next solutions coming out of. And that's using these engagements, using these data sets for more of a predictive effect, right? So when you're actually marketing a behavioral health solution, there's of course the forefront of providing access, connecting them with a valid provider, a certified provider, and all the things that promote the best outcomes. Secondarily, on the purchasing side, someone who's making a purchasing decision, well, are you getting something that, to use the analogy, places a bucket under a leaky faucet? Or are you actually going to do something to prevent that leak from occurring, right? So where I'm going is what can be done in the predictive space, whether it's population risk, whether it's leading indicators on a self-insured group, whether it's looking at the payment groups at risk, or chronic conditions, as we've learned even more about on this call. But the predictive element to behavioral health solutions is going to make the next company or sets of companies more marketable and more successful in this space by delivering that.
No, perfect.
I totally agree. I would say predictive analytics and AI are going to be really important. And that's a big part of what we do at Trellus as well, because we are kind of a population health play, and we utilize, and then we track, clinical indicators of inflammation, and we also track patient reported outcomes on a weekly basis. So we can actually monitor how our patients are doing and identify areas of rising risk, not just physically, but also emotionally and psychosocially, and then intervene with the patient and their provider. So that having that level of kind of monitoring and intervention, I think, is really important to manage a population and avoid, costly unplanned care and people missing work and needing surgeries. It's really, I would totally agree. We've invested heavily into our AI and predictive analytics platform in order to enable us to do that type of monitoring and intervention.
Okay. No.
I think both you and Jennifer would have to agree. Other solutions, other areas, they have it easier because there's a known area of impact, right? So diabetes, it's A1C, it's ROI, or whatever it is. With behavioral health, it's kind of wide open where the focus is for impact and what the measures are. So you're kind of writing your own script as you're going, right? Jennifer, you as well. Like, I think that's one of the things that's a challenge. Like, other areas have it, a little more clearly defined, and we're still kind of writing the book collectively as to what the impact indicators or leading indicators will be.
Yeah, I mean, we're definitely investing heavily in AI and prediction as well. And one of the solutions we'll be bringing to the market is predicting mental health crisis. So really exciting times in the AI world.
Perfect. No, that's really interesting. Obviously, hear your guys' view on it and agreeing on that point. I think obviously after this final point, we'll move to go on to Q&A. We've already had a couple of good questions. So if anyone else has any more, please put them in to ask any of the panelists. But I suppose to finish off from your guys' side, would be good to hear, a clear point. Obviously, I know you can't see into the future, but your predictions and maybe needs for where, the digital mental health, I suppose, area is going to go within, your own company, but broadly where, you think it's going to have the most effect in the next, say, 5 years. If Monique, you want to say something on that.
I guess, yeah, I've already said, I think it's, the next couple of years, I don't know if we're going to see the same amount of investment going into digital health apps as we've seen in the last year. Post pandemic, it'll be interesting. It's already gone down a little bit, but companies who've received funding, their ability to demonstrate their effectiveness, their outcomes, and really, hold the course and, manage their businesses effectively, manage their cash flow is going to be really critical, just given the, economic and geopolitical uncertainties that we're facing right now. And then, and just, demonstrating that they can, really have an impact on outcomes and having their own data and publishing that. So those are going to be the winners, I think, in the next 3 to 5 years. And there'll be a little bit of a shakeout, but that's kind of what I see.
Perfect. And Jen, on that point?
Yeah, I mean, I guess one of us has to use the buzzword of consolidation, but certainly with so many players, I think we'll continue to see more consolidation, companies kind of coming together to add value to one another to fill gaps. Definitely, we'll see an increased kind of demand for quality and also for affordability of these solutions. I think this will likely also result in more of these types of solutions moving into the digital therapeutic realm. And I don't think we're going to talk about that too much today, but that will certainly cover off on quality, by these folks meeting those regulatory requirements. And hopefully, this movement will also kind of push out the snake oil, as my CEO likes to call it, or the folks that don't have the evidence to back up kind of the quality of their solutions. So I think we'll see more and better AI, a demand for accessibility, for quality in these products, and continued push for kind of location agnostic care, right? So for people, the ability for people to use these tools to get care kind of outside the office, wherever they are, whenever they are. And I think, I don't think the investments, they may slow, Monique, I would agree with you, but I think I saw a projection the other day that, the value will more than double in the next 5 years. So again, I do not think the market is saturated. There's generally need. There's a push for parity in mental health right now. Even though it's been around for a long time, it's kind of being brought back to the table as something that will be audited. So I think there's a lot of exciting things happening in digital mental health that support the work that we're doing here at COA.
Great. And Mike, finally?
Yeah, it's pretty well covered. So, we spoke a couple moments ago about the predictive piece of it. I think that's critical. So enough said there. I think you'll see tactically, the expansion of, payer contracts with point solutions providers across the behavioral health space, even before there's any type of consolidation, because right now it is very much the access that's driving a lot of growth right now. And that'll lead to, not to say winners and losers, but who kind of sits atop the valuation pyramid, right? And then, for me, going back to the core element of predictive, what does it need to deliver, and what do we feel we do at UpHealth, is that we have to be able to deliver actionable insights from this data, right? So again, taking more of a population health and or managed care approach, which is where our platform serves. It's about getting the data points together across the community of care, inclusive of everything. Our biggest clients are plans and government, state, local education, whatnot. So we look to provide the actionable insights. And I think that for everybody, just to take a step back and say, what does the mental health or behavioral health dashboard need to look like for success, right? How do you know how fast you're going, how hard your engine's working, what do you have in the tank? Can we get to a common dashboard that'll enable the more meaningful results? That's the biggest question I still have, and I'm eager to continue learning about.
Perfect. No, that's great. Well, thanks for obviously discussing those points. And we've had a couple of really interesting questions come on from people live. And I think maybe the first one has come from Piney, who actually works for Amwell and has a background in clinical as well, and now works on the commercial side as VP clinical. But it's do you see access improving if big payers are willing to contract with digital health offerings? If so, can you share progress with that strategy? I think maybe Mike, with your experience with payers, could be interesting on this point. But do you see the access of improving if big payers are willing to contract with digital health offerings? We'd love to know your thoughts.
Yeah, I mean, the simple answer there would be yes. I don't see how it wouldn't improve access to care. I can tell you it's been a targeted focus for us. The challenge that at least I've found personally, and from an organizational standpoint, is selling a comprehensive solution. So what I mean by that is a lot of the payer contracts and or agreements are very narrow in focus, and you have to make sure you have a solution that meets their needs rather than sometimes a more comprehensive approach. So what we found is for example, in our substance abuse and treatment, we're going to be announcing several new payer contracts next week. And that's great, but it's more of a narrow focus for, okay, how are we going to improve access to substance abuse? We need to make sure that includes follow-up, telepsych, behavioral health consults as needed. So it's really about making sure you get access, which is a great anchor and foundation, and then expanding the service offering to meet the total needs of the population.
Yeah. I suppose, Monique, anything from your side to add? I know obviously experience working with the payers.
Ultimately that would be fantastic if because just the reimbursement models currently, it's the challenge of getting access and reimbursed for mental health services is so difficult. And if payers were implementing more of these and enabling access, more affordable access and digital access to these programs, I think that would be ideal. It just, again, it takes time. And, that's one of the reasons we started going DTC is just, we want to be able to offer that access before the plans can offer to their millions and millions of members. We want to be able to just deliver it and provide that level of care because patients really need it. And so that would be the ideal, but it's going to take time. I just think it's going to take time for them to vet solutions, roll them out nationally, especially because there's so many out there and they need to evaluate them and figure out which ones work and which ones don't.
Yeah, great. And Jen, anything on the kind of payer focus side?
Yeah, no, I mean, obviously, I think I actually do think that the more innovative plans are starting to adopt some of this technology. And I think a big driver of that is we're seeing a decrease in the digital divide, or if you would prefer to call it in digital equity, right? Where most people, the majority of people across the board do have access to smartphones and can access digital health and digital mental health in a different way. So yes, agree with everything that's being said, and certainly think it's a way to scale and increase access amongst the plans.
Perfect. Thank you. And then another really interesting question from Fayad. I would love to hear about digital health work to address mental health issue in teens. Now I know, historically the IBD side of things is generally found at a younger age. So maybe Monique, you're best starting off on this and the work that I suppose what we've seen, being more of an issue within younger people, just the general mental health crisis, how this can work best to help teens.
Well, yeah, I mean, IBD is typically diagnosed as late teens, early 20s, although it can be diagnosed when, when a child is a baby, unfortunately. Right now, we're only focusing as Trellus on adults. We're not focusing on minors, but in our co-founder, Dr. Marla Dubinsky, is actually a pediatric gastroenterologist who focuses a lot with teens and the challenges they face. Can you imagine as a teenager having a disease like IBD, which has such major life impacts and symptoms, has just a tremendous mental health burden. But I think just in general, outside of IBD, that's an area that these apps can help with addressing. Teens often don't know how to vocalize or even approach adults about these issues, or have problems even recognizing what the mental health issues really are. So having just the whole awareness of these applications and these options for them elevated is, I think, going to be very helpful. In general, I think that just the whole conversation around mental health being more acceptable and the stigma going away is going to help with access to teens improving. As parents are more open to it and recognize, I know during the pandemic, both of my children, I encouraged them to get mental health support because they were so stressed about what was happening and the uncertainty. And that's, anxiety is just the natural way of dealing with uncertainty. And you're put in a situation you don't know what the outcomes are. It's going to cause, stress, anxiety, and can lead to depression. So I think in general, just the way the whole market is moving with digital health and mental health is going to improve access to teens getting the help that they need.
Yeah, no, that's a really good and appreciate the insight to that as well. And I suppose, Jen, on obviously what COA are doing and your thoughts on how, the need for more help within teens and people earlier. I know college has been a big focus for people as well. Generally, people who go into college can suffer with mental health problems and things like that, but your view on how it can help teens?
Yeah, I mean, we know that teens have been disproportionately really hit hard with this pandemic as it pertains to their mental health. And I actually have 2 teens myself as well. So can understand what they're going through. And then we know that they're accessing everything they do on their phone or online. So I do think digital health is an awesome tool to start to provide teens with the support they need from a mental health perspective. Our focus at COA is actually 16 and older. So we do hit some teens, like older teens, and we are starting to hear more from colleges. To your point, there's certainly a lack of support for mental health for college students. There's very few mental health counselors on a college campus for the number of students that they're supporting. So I definitely agree that digital health is a way to support teens. There's some multiple mental health solutions that are popping up, like Brightline and others for teens specifically. I think it's an awesome way to bring them the support that they need. And we're moving in that direction. However, our next focus is supporting parents of teens that are struggling with their mental health. So
yeah, no, that's really interesting. And Mike, from your side, maybe, obviously gone through the college cycle yourself and working with people who are younger, your thoughts on the need for it in that aspect?
Yeah, simply said, massive unmet need. Primary care is not going to be the avenue to solve it, pretty much because at that age group, there's even less engagement with the PCP, more often than not for health reasons, but even, further just having someone that's going to provide that. So it is going to be app-based or platform-based, however you want to, however you want to categorize it, excuse me. But really, it's right now a massive unmet need that's going to need to be driven, somewhat from the employer side as a support of family overall well-being, and probably from several other areas as well, but huge opportunity.
It's interesting. You may be familiar with Kooth in the UK. Kooth do a lot of work with teens, and they're sponsored, I believe, funded through government initiatives, which is, I think, amazing. It preserves anonymity. They can get support they need very quickly and free. So I think that's a great model. I know they're trying to expand into the US, which is, hopefully they can, because I'm not aware of similar services available to teens like that in the UK.
Yeah, no, it's interesting. A company I've worked with called Timely MD do some on that aspect as well in the US, but Kutha are a great one over here, and we're certainly lucky to have them. So no, that's a great point. I suppose final question that I wanted to ask from the Q&A was one, you all spoke about a large number of companies in the space not having an evidence-based approach. Should it be left to market dynamics for these companies to be shaken out over the coming years? Or does it require further regulation from the FDA and other international regulatory bodies to ensure a certain standard of care is met? I think very relevant to kind of what we've spoken about, quite a harsh approach potentially, but would love to know your thoughts, maybe starting with Jen on this one.
Yeah, I think I mentioned earlier, I do see the market going in the direction of digital therapeutics, and those folks will have to kind of answer to the FDA in regards to their quality. And so I do definitely see a trend in that direction. And again, there are other independent companies that are evaluating these apps, but I think just as a general practice, again, there are questions I mentioned earlier that you can ask as buyers around the evidence. Are they the gold standard of evidence? Are they RCTs? Are they done by the company themselves, or are they citing other people's evidence? Are there clinicians that are doing the work within the company? So I think there are a lot of questions you can ask now. I do see the trend going in the US towards DTX, and COA is going there as well. Yeah.
Perfect, great. And Mike, on that point with regards to where things can move to potentially help the market within this, what do you think?
Yeah, there's a lot of layers to that question. Because if you're going to, certify and have it go through regulatory channels, then that's going to impact reimbursement and, all the things that follow. Not necessarily that there's anything wrong with that either, but it does bring in like another, 2 or 3 layers on the decision side. So I think why this is so tricky, which is fairly obvious probably to all participants and panelists, is that there's a certain level of engagement on the behavioral health side that promotes overall wellness. Where not to say I don't support certification, but that several mediums can accomplish that. Once you cross over a level where specific targeted care outcomes are required, then yes, I think we need to look at that more closely, and regulation is probably appropriate.
Perfect, great. And then finally, Monique, your thought on that, the introduction of areas?
I mean, clearly adding a layer of regulatory scrutiny to it is going to, slow down innovations and add more cost to the process. So that'll thin out the market in terms of players who have the resources to go through that process and actually get there. And I think the jury's still out on what the reimbursement model is for digital therapeutics and whether or not that even works. So especially in the mental health space. So I think it's going to take another year or so for people to see what happens and where the market goes with respect to FDA regulatory scrutiny, software as a medical device, that type of thing in the US. For mental health.
I would agree. Yeah, no, I would agree that's certainly going to take time. And I think there's, baby steps with some new CPT codes coming out, but there's definitely still questions about kind of payment and coverage, et cetera. I would totally agree with you there, Monique.
Perfect. No, that's really interesting. And from our point before, speaking about the teens area, we've had the founder of Kudo in the chat speaking on that existence. So it would be good to check that out after. But I appreciate all your guys' times. And I think that seems like a great place to leave it today. Unless there's anything else you guys would like to say or discuss. Really interesting to get the insight from all of your companies and backgrounds in the space. Thanks for everyone for joining us. And obviously, thanks to the panel. Apologize if we've not been able to address your questions, but I'm sure if you DM myself or the panel, and we'd be happy to respond. And if there's anyone, I know I've got numerous people from in the market in the chat, always happy to connect with myself or anyone in the market. Finally, if you have any upcoming hire project, CM's expertise are always happy to help. So DM me on LinkedIn, happy to introduce you to any of these guys. But that's it from me. Thank you for attending and have a great day. But thank you guys.
Thank you.
Thank you.
You're
Thanks,
welcome. Thank you.
Bye.